Many people face difficulties managing their medical records and prescriptions. Losing old prescriptions or forgetting medication details or even their important doctor appointments can lead to incomplete health histories and poor treatment decisions. Our solution addresses this challenge head on. Hello everyone, we are Team MediMinds and our problem statement is SIH 25131. In this Smart India Hackathon 2025, we present our app SehatSphere that brings innovation and simplicity to healthcare management. Our platform begins with a simple and secure registration process. Once registered, users can log in to create and manage their personalized digital health profile. Now,
The user,
let's quickly
whether
look
he
into
or
the
she
registration
be a
process.
patient or a hospital authority, can simply log in for old user and register for new user using just his name and selecting whether he or she is a hospital authority or a patient. If the user is using this app for the first time, he need not write the patient ID as that will be created automatically for the new users. Thus, as we get into the dashboard of our app, here there are various tabs that a user can get access to. First, we'll go through the tabs for the patient. First, he or she gets to see the profile and contacts. Rather, this is a place where his or her emergency contact names will be saved. It may be mom, dad, or even the doctor's number as we have done here. Next up, we have the disease profiles, which will include the list of diseases that the patient has suffered or is suffering from. Next, we come across medications, which include the list of medicines that a patient is required to take or has taken or will be required to take in order to cure his or her disease. Here, one can also upload the prescriptions. For now, as is a demo video, we are here adding just the file name, but in the full-fledged app, the user will be provided the attachment option to upload his or her prescription from the Google Drive or even just clicking a photo using the camera. Next, we have the tests and results where the user is required to fill up the profile, that's the disease name, the test name and the result that has come. Now here also the attachment option will be provided for uploading the report or the test details. Next, we have the tab on issues, which lists the latest or the present issues that one is facing. For here, for example, we have written high fever and also we can provide a little details about the issue for better understanding, or if for or for any emergency cause or for any emergency cases in the near future. Here you go, it got saved. Next, we have the tab on appointments, and here through this app, the patient can also get reminded about his or her upcoming appointments. So here we can select the date that we have appointment on and the reason. and the appointment gets saved. Next up, we have the mood tracker. Now, this plays a very important role in our app, as through the mood tracker, it can also track the mental condition of a patient. That is, in case of if the patient remains sad for a long time, this may also help to detect any case of chronic depression or any such mental issues, and thus provide faster and efficient treatment. Next, we have the option on Consult a Doctor, where a patient can call or even text the doctor his or her problem, and he or she will get the reply from his or her doctor. Next, we also have the SOS Request tab. In this tab, one can send alerts to hospital and even to the emergency contacts that they had saved. Now here, the registration process can be done using the doctor's name or even the hospital's name. Here, we have done it using the doctor's name. The first thing that we can do is to get the details of a patient in case of emergency conditions is to write the patient ID. Once the patient ID has been entered, the authority gets access to all the details, profiles, the medications, the prescriptions, or even the tests that the patient has done, the latest issues, and even his or her appointments. And for serious situations, the contact numbers or the emergency contacts of a particular patient. Now let's look into the tab that the hospital authority can get access to. In this tab, the hospital authority can upload the prescription of a particular patient just by entering the patient ID, profile, and the notes, or rather the file name. And now, here, as I had said earlier, in the full-fledged app, the attachment option will be provided for the test and the uploading prescription tab. Next up, we have the upload test results, where the test of the patient are uploaded. Here you go, the test results are uploaded. Next, we can see the number of visits and admits of a particular patient to the hospitals or to a particular doctor. Here, the hospital can select admit or visit to get the list of the number of admits and visit to a doctor. And also, the reason will also be added. Now, as we had sent consult doctor, that is a text to the doctor, using this tab, the hospital authority or the doctor can reply back or suggest the needful to the patient. As here we can see in the patient, we had added the patient is vomiting since last night, and here the doctor gives the required or the needful medicine that he or she has to take. Next, here the hospital authority can check on any SOS alerts that the patient had sent. With this prototype, we aim to redefine healthcare management by making it more accessible, reliable, and technology driven. Our solution ensures that no prescription or health record is ever lost, while empowering patients with knowledge, timely alerts, and emergency support. This is not just a project but a step towards building a smarter and healthier future. Thank you for watching our demo video and supporting our vision.